Open enrollment. It is now open for both Medicare and the Affordable Care Act. The ACA opened up just yesterday, runs until January 15th. Medicare open enrollment is available until December the 7th. Health coverage, oh boy, it can be complicated, right? But we have experts here to help us all sort it out. Catherine Sevier with AARP, Laura Packard with Healthcare Voices, and Steve Edmonds with Alliance Insurance Services. All right, so this is what's going to happen. You get to send in your question to these experts, and the way you do it is through the text 336-379-5775. All your questions are anonymous, but this is your chance to ask an expert and get an answer in real time. All right, so let's first and foremost start off with what happened just yesterday, Laura, and that is ACA open enrollment.
Yes. ACA open enrollment for health insurance for next year has begun. So you can go to healthcare.gov anytime between now and January 15th to enroll for a plan for next year. But you need to do it this year if you want your plan to start January 1st.
That's right. You have to do it by that December time, correct? For it to start January 1. Okay. All right. So, Catherine, let's talk about Medicare open enrollment. That has got kicked off in November.
It did. And it is a time where you get the opportunity to review your plan and decide whether or not it is the one you want to keep for the subsequent or the next year. And the reason you might want to change your plan is there could be a change in your health condition, a change in who your providers are, and where you want to receive your care. So think about it, and also be really smart about what medicines you're taking and know what you need from a Part D plan.
All right, I meant to say October. I'm already getting ahead of myself thinking November and December. All right, this is how time flies, right? All right, so Steve, let's kind of talk about like 3 things you should know, not just for Medicare enrollment, but also ACA enrollment too.
Yeah, so a lot of moving parts when this open enrollment time comes. But yeah, you want to look at your current coverages. Catherine just mentioned networks change, so you want to make sure that the plans that you're enrolled in are still going to be covering your current doctors and medical facilities for the coming 2024 season. So that's one important thing. And then you want to compare plans, especially if you're on a Medicare Advantage plan. One of the most important things that I know to look at is your annual out-of-pocket maximum. What is that? You want to choose a plan that has a really low out-of-pocket maximum if you can find one in your area, because that's just going to save you money at the end of the year if you have a lot of medical expense. A lot of people shop these plans and they base a lot of their decisions on the dental benefits or the vision benefits or the over-the-counter drug benefits. But your most important benefit, never lose sight, is the medical coverage, because that's where it can be really costly. So look at those medical benefits. What does it cost you to be hospitalized? And what is your annual out-of-pocket maximum? 2 really big things to remember.
Okay. All right. So we're talking Medicare. We're also talking ACA. We're also going to talk about Medicaid. So Laura, of course, that the expansion is happening.
Yes. December 1st, North Carolina will have finally expanded Medicaid, which means that adults aged 19 through 64, so before Medicare, if you earn up to 138% of the federal poverty line, for example, singles earning about $20,000 a year or a family of 3 earning about $34,000 a year, you may be eligible for health insurance through Medicaid. However, if you go to healthcare.gov right now, since the ACA enrollment has started, there's this time period before Medicaid expansion starts, December 1st. So if you checked right now, it might not give you the right eligibility information since Medicaid hasn't expanded yet. So I would say if you are near those numbers, so you're a single person earning about $20,000 a year or a family of 3 earning about $34,000 a year, pay close attention. You can go to healthcare.gov now, but check again after December 1st when Medicaid has expanded to see whether you're going to be eligible for affordable health insurance through Medicaid. And if you guess wrong, if you've already registered this month and it turns out you're eligible for Medicaid, you have until January 15th to change your ACA enrollment. So you have time to fix. If it turns out that you guess wrong or that things change a little bit, you got time to get it sorted, but just to be aware if you are at those numbers, your situation may change.
Gotcha. Okay. All right. We're already getting some questions in here. So, Catherine, this person says, can you roll over your Medicare plan from last year? Do you have to go through all the rigmarole of looking at different plans?
You do not. You do not. And if you're satisfied with your plans and you don't think that there's anything that you're concerned about with your providers and your health, then you may just want to let it go another year. And know that next year there'll be another open enrollment period during about this same time.
And again, open enrollment for Medicare is only for people who already have Medicare. So
Right.
if you are not at the point where you have Medicare yet, this is not your time to be enrolling in Medicare. Hey, Steve, this person is saying, what are some downsides, or is there to the Advantage plan versus a Medigap?
So the real positive to a Medigap plan is that if you have a really good Medigap plan, like a Plan G or a Plan F, most times if you're sick and hospitalized or having procedures done, you're going to have close to 100% coverage by the time Medicare pays its part, and the supplement, Medicare supplement, which is a Medigap plan, it comes in behind Medicare and finishes that up usually. So that's the real positive, is that's like 100% coverage. The negative is that those plans are a little costly. They're going to cost you some premium dollars every month. So, you're going to have to pay premiums to get that really good coverage. The Advantage plans are usually going to be nearly zero premium. In some cases, they are zero premium. And they're going to be very good coverage. They're going to have copays associated with most everything you do. And you'll have a high out-of-pocket limit, maybe of somewhere between $3,000 to $4,000 per year on a really good plan. And then the Medicare Advantage plan has a lot of bells and whistles. You have dental coverage, vision coverage, eye care coverage, over-the-counter drug coverage, and I could go on and on. It's about 12 to 15 more benefits that you can potentially get. So both plans have merit. They're both good plans. I think you just have to sit down and just overview the whole situation to see what works best for you.
All right, and we're going to talk about that, like who can you go to for help for that kind of thing? Because sometimes you look at all those plans and you're like, oh my goodness, my eyes are crossing. We're going to talk about that when we come back in the next segment. 336-379-5775.